3 things that make clinicians feel stuck, or actually that make clinicians stuck. And they might not be what you think. What's up, guys? I'm Doc Raj.
And I'm Doc Caitlin.
And this is the Performance Rehab Authority podcast. Every single clinician that I've ever mentored and worked with has suffered from these 3 things, and it leads them down a road of feeling frustrated, not confident, wondering if they're doing the right things, and they often describe it as just throwing things at the wall to see what sticks. It leaves them coming in, or it leaves their patients coming in, telling them that they don't feel better, that things are worse, that they've got this new pain, and then the clinician changes the entire plan or jumps around from one treatment to the next. I think it's your neck, I think it's your elbow, maybe it's your shoulder, let me treat this time, let me treat that time, and leaves everybody completely confused. The clinician, the patient, anybody that's watching is confused. And then also leaves the patient probably with a lot of maladaptive beliefs about what's going on with them and if they can even get better. And leaves the patient saying things like, well, I tried physical therapy and it didn't work for me. But really the problem was, one, and this is the first thing that clinicians do, is that they lacked a system, right? They didn't have an evaluation process that leads them to actually understanding what's going on and having a plan to deal with it. Having an evaluation that actually details out the specifics of the treatment from A to Z to get these people back to where they need to be. We do a lot of work with that, with anybody that we mentor, with anybody that comes on board, anybody that has ever been a student of ours. If you've ever been in the situation of like, stand up, get on your back, what do I do next? All right, lay down. All right, stand up. Now roll to your side. It's super disorganized, then you don't have that system. If you ever find yourself saying things like, cool, 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 and repeating back what the patient's just told you as you're just buying time to think, to try to figure things out, you don't have a system. A system means that it's pretty much an algorithm that I'm starting here, I'm going here. If this happens, we're going to split off. If this happens, we're going to split off. And it's very organized and it makes sense and it helps you clear out all of the other differential diagnoses as well as highlighting the impairments that you're going to have to treat. And then that leads us into the second thing. When you don't have that clarity, you start to jump around. You don't stay the course. You want to talk a little bit on that?
Yeah, I've seen a number of patients that when I didn't have confidence that what I was doing was the right thing because I had the appropriate skill set, somebody would come in, they would say that they were feeling worse or that they just weren't better, and I would jump around instead of trusting what I found in my evaluation and knowing that this is the right course, digging into, okay, well, what are they doing outside of PT, outside of what I've given them that's making it worse? And yeah, it was a confidence issue.
Yeah, and I would say that's one of the biggest things that comes from the lack of the evaluation. If you had an evaluation, if we bring that back to the first one, if you had an evaluation system and process that led you to where you're going, then you could have confidence. If your clinical reasoning made sense to yourself, even, you could have the confidence to stay the course. But since you don't have that confidence, you don't have the clarity from your examination, then it makes it really hard to stay the course. And you want to solve the problem, right? You want to help them with this new pain or this other thing, and you want to give them the magical fix, the magical cure, use your magical hands or give them the one exercise that's going to change everything, and that's just not the way that works, right?
That one magical exercise doesn't exist. It's repetition and it's doing the thing that works.
Yeah, and also every time that they're coming in, you're jumping around, you can't reasonably expect them to make progress. If you're trying to get a heavier squat and then one day you squat, and then one day you bench press, and then one day you sprint, and then one day you're throwing medicine balls at the wall, and then one day you're doing pull-ups, and you're just doing random shit. Do you think that you're going to get better at squatting? How would you get better at squatting?
By squatting.
By squatting, by progressively increasing the load, by consistently training the same things with higher intensity, higher weight, shorter rest periods, tempos, manipulating those variables, but still working towards the goal. You can prescribe a whole bunch of exercise that doesn't actually move somebody towards their goal. The third thing that a lot of clinicians get stuck on is that they don't have the experience, and they only rely on their own experience. If you have zero experience, how do you rely on that?
You can't. And the problem with what happens in physical therapy is people tell you to fake it till you make it, and you just keep faking it. And that one day you'll get there and have the experience because you've been doing it for so long. And so you have to have the right experience to have that outlook. And so if you have all the wrong experiences from just faking it the whole time, you never learn.
Yeah. Or you learn extremely slowly and at the expense of other people's lives. And I will hammer that fact home. You are directly responsible for the outcomes of these people. In a little sidebar here, but in physical therapy, the burnout rate gets so high so fast. You said, what, 6 months you were burnt out?
Yeah.
Right? Like I was burnt out pretty quickly too. When people just become a number, when you stop having the human factor and you stop having the give a shit factor, you stop realizing that these are humans. Like they're coming to you as a professional, as a doctor, to help them get their fucking life back.
They're inconveniencing their day-to-day life to come in to see you once or twice a week.
Not to detract from that, but even just like in general, like if you're going to a therapist and you have a problem that you are trying to solve, like you expect them to be well equipped to help you solve that problem, not to just be making shit up, right? Like imagine you went to a surgeon and they don't know what they're doing. They're like, we're just gonna cut in there and we'll figure it out as we go along. Like, no, like surgeons are prepped for that. Like they have long residencies and lots of reps with mentors to walk them step by step by step through the process. They don't just get their doctorate and be like, you know what, that's it, I'm a doctorate, I'm gonna do surgery and I'm gonna figure it out as I go along. That would be absolutely ridiculous.
Graduating with your doctorate does not mean that that's the last time that you learn. You have to keep learning and keep raising the bar for yourself. That's, if anything, an entry level, hey, now we can do this and really start learning our shit.
Yeah, really, like that's permission to play. Right? Like that gets you in the door. That teaches you how to pass an exam. PT schools don't have a strength and conditioning curriculum for physical therapists. There's like very basic education. Like shit, we didn't even have like real exercise prescription, right? We were never taught how to break down a squat or a deadlift or a press or a clean or a jerk or a snatch or a sprint or a single leg squat.
And you certainly don't learn how to periodize a program and write out different blocks.
And if you're just trying to figure all this stuff out on your own, you're doing it at the patient's expense. You taking your time, being comfortable, faking it till you make it off some shitty advice that your CI gave you, because that's what they did, is directly negatively impacting your patients, which the first rule of healthcare is like first do no harm, right? And you are in fact doing harm. A lot of physical therapy is not only completely useless, but harmful because people are faking it till they make it. And they are just doing things that are keeping patients in pain. I can't tell you the number of times that people come in here and we have them stop doing the things that other providers gave them. And they're like, oh, wow, I feel so much better now. And the only thing we did at that point was get them to stop doing the things that are bad for them. Happens with most new patients that come in here. And you can solve that by getting a mentor, by finding people to follow along with who actually know what they're doing.
When you have a mentor, you actually get to pull from their resources and experiences. So if I didn't know what I was doing this whole time and then I got Roger, I would have my experience, which not super important, Roger's experience and then the experience of all of his mentors and all the resources that he has available to him if I have a question.
Yeah, absolutely. And I mean, that's huge because as I was learning, my first couple years of a PT, I got a ton of mentorship from like an aggregate of about 80 years of experience. So all of the reps, all of the lessons that they've learned, all of the patterns that they've picked up on, because really that's one of the big things that separates a novice clinician from an expert clinician is is pattern recognition. How fast can you recognize the things that are going to cue you into what's going on based on what people are saying? I was able to take and pull from 80 years of that. It would take me a long time, about 80 years, to amass that on my own. And now patients' minds are blown because I can tell them exactly what they're feeling, what they're thinking, why they're thinking about it, how it's affecting their lives, like what happens at different times of day in their life based on a little bit of conversations, and I can fill in the blanks, and they're like, holy shit, this guy knows what he's talking about. But it's because I've been able to time collapse by having all of the other experience that I can pull from instead of just faking it till you make it. Now, yes, not everybody wants to go out and do a residency and do 2 fellowships. Not everybody has the ability to do that or wants to make the sacrifices that I did working obscene hours and not seeing my kids and all this other stuff.
Yeah, I learned what I know because I know Roger and because I've worked with Roger. So I didn't have to go through all of that, but you can learn it through working with someone who's had that experience.
Yeah, absolutely. And that's not to say that I know everything. I sure as hell don't. That's the Dunning-Kruger effect, right? Like when you're a novice, you think you know everything. When you're in PT school, you're like, fuck, I know everything. Talk to me, I'm in PT school. What up, bitches? Right? And it turns out like you don't know shit, but your confidence is super high. And the more that you learn, the confidence drops until it comes to an all-time low. And then when you become an expert, it never really gets back up to where the novice is because there's so much more shit that you don't know. And you take the opportunity to learn from every interaction, from everybody. Like every student that I teach, every clinician that I mentor, all of my coworkers from Caitlin, everybody, like I learn from them daily as well. You get really good at learning in that situation from everybody that's around you. So you really got to realize that you're doing your patients an extreme disservice when you're just trying to figure it out on your own. And you could be much better, right? With better client outcomes, you could be more fulfilled in your career, which spills over to your life if you just learn the system, if you stay the course and you find the resources to drive the change.
Yeah, so that being said, make sure that you click the link in the description box and sign up for our newsletter. That way you can get information about any upcoming events, and Roger and I can hint at you all the things that we have coming down the pipeline soon.
You're definitely not going to want to miss this, anything that's coming down the pipeline, because all of it is designed to just pass on all of our experience, our knowledge, and shortcut the process for you as much as we possibly can.
We want to help you be a badass performance PT.
And remember, if you're unhappy or unfulfilled in your career or your life,
no one's coming to save you.
It's your responsibility to lead by example, to pursue excellence, and to learn new skills.
And welcome the challenge of raising the bar.
Drive the change that you want to see.
And we'll see you next time.